We have a growing epidemic of deaths from prescription overdoses, and they're the #1 cause of accidental deaths in the United States. And out of those, 40% are from opioids. Those are narcotics. We must have a lot of people in pain.
There are a lot of people in pain in this country, and a lot of people are just addicted to the drugs, whether they have pain or not.
Well, they start out probably with pain.
Well, we have an awful lot of people who are not getting prescriptions at all that are addicted to drugs. We're looking at something like 12 million Americans.
Well, how do they get them? I guess friends give it to them.
Well, you get them on the street, they get it from their friends. Yeah, they account for 500,000 visits to emergency rooms every year.
Well, you know, one of the things that I noticed was when you had your hip surgery, and they sent you home with a prescription for Percocet, I think it was. They gave you this gigantic bottle as if you were going to be taking it for a long time.
Right.
It's like, it seems like the doctor should have a little bit more control over that.
Well, most people use drugs. They're not all like me, Vicki. I used them for 3 days and stopped because I didn't like the effects of what the drugs did to me. And the pain wasn't that bad this time.
Some people like the effects of what
Well, they do, and they're the ones that probably use it the most. And they're the ones who have all the problems that relate to it. I mean, 77% of the people who have problems with drug poisonings do it unintentionally. And
well, I also think that when a doctor prescribes them, that people get this false sense of security that
like
they're
it's
safe.
Okay?
Yeah.
Yeah, well, I mean, look at some of the drugs that we use that are used for pain that are not safe, like the NSAIDs and aspirin.
That are not prescription, you mean?
Yeah, or prescription, but you're right. Yeah, a lot of them are not, most of them are non-prescription. Or Tylenol. I mean, NSAIDs cause something like 30,000 deaths every year and 300,000 admissions to hospitals. That's an incredible number of people who are dying from it. I mean, it should be in the newspapers.
Well, you know, drugs that are taken the way they're supposed to be taken cause something like 400,000 deaths a year.
Well, not all quite that way. Those are 400,000 people from all causes of death. People taking them the right way, people not taking them the right way, mistakes that are being made in the hospital. So you've got a good point. 400,000 people is a lot of people who are dying every year from that. I mean, that's an astonishing number of people that we need to be aware of that are dying from what medicine is doing. And that doesn't even count the rest of the things, the errors in other areas for deaths. So when we're looking at deaths from prescription drug overdoses that are done unintentionally 77% of the time, only 13% of those are suicide attempts, and the percentage that's left is nobody knows exactly what happened. That's a big thing to pay attention to.
Yeah, I think that this is all giving us a pretty strong message that, you know, unless you absolutely need it,
just don't.
It's better to not take a drug. You know, so often people will be like, oh, I have a headache, and they just
pop a couple aspirin, right.
A couple aspirin,
a couple of Tylenols,
or whatever it is.
Right.
And, you know, maybe there's something else. Maybe there's a message as to the reason why they have a headache. Maybe they need to stop and lie down for a minute, you know. Maybe they're stressed. Maybe their neck is sore. Maybe if they just rub their neck a little bit.
There are a lot of things like that we know. And it's your lifestyle that's your most powerful medicine, Vicki. It's not so much the things that we get into trouble with that are in other arenas. I mean, lifestyle takes care of so many things. If you eat right and exercise right and your stress isn't too high and you're sleeping well and you weigh what you should, and you've got a purpose in your life, a lot of these things aren't going to happen. You don't need to take drugs.
Well, many times our bodies are giving us a message, and we need to listen to what our body's telling us.
Sure. Don't just treat the symptoms. Treat the cause of what's going on.
You know, we're always talking about alternatives to pain, too, you know, like acupuncture and chiropractic and the photon stimulator and DMSO. And
there's so many, even copper, you know, there's so many things that we can use, or magnets. I mean, there's a wide range of things that are possible to use for situations where we have pain. So when we're looking at accidental deaths, it's an eye-opener. We need to do something to control how much medication we're relying on. It's the great expertise of the pharmaceutical industry and their advertising capacity with direct-to-consumer ads and what they're doing to convince doctors to rely on drugs that's gotten us into trouble.
And I think that people that are taking these drugs also are a high risk behind the wheel. Speaking of accidental deaths.
Exactly.
You know?
So we shouldn't be thinking of drugs first. We should be thinking of if we think we've got a problem, a drug may be one temporary thing to use as a solution, but there are usually many other ways to deal with with why you hurt or why you're taking that drug, that can be discovered, and very often lifestyle or simple non-invasive therapies are much safer and